And welcome back. Planned Parenthood of Greater New York is a leading advocate and provider of sexual and reproductive health care in New York State. With 23 centers covering 65% of the state, they proudly serve over 560,000 Latinx patients annually. And Latinx individuals face significant barriers to accessing sexual as well as reproductive health care due to the factors like race, immigration status, income, and nearly a threefold higher likelihood of being uninsured compared to non-Hispanic whites. Joining me now and discussing more is the Director of Community Engagement at Planned Parenthood of Greater New York, Angelica Medina, and we thank you so much for being with us.
You. My pleasure.
Thank you. And so, as you talk about the work that's going on at Planned Parenthood of Greater New York, thank you for taking the time of being with us. And, as we talk about Hispanic and immigrant communities, when it comes to these rights, reproductive rights, things like that, um, you know, it's a struggle somewhat. Explain.
Absolutely. Immigrant communities are impacted in such negative ways, especially as with the recent events occurring around reproductive health, but in general, right? So, migratory policies, reproductive health policies, it all ties up and it results in these communities becoming even more marginalized and vulnerable. It places barriers on reaching and the healthcare that people need. And I think we can agree that healthcare is a fundamental human right. So that is where our communities are, especially as well talking about the recent migratory crisis into some of the states.
Yeah. And so for yourself, what are you seeing coming across your door by way of, uh, clients? Are you seeing any common threads and trends?
Absolutely. So, my team, which is the community engagement team, um, part of our work revolves around our Promotores de Salud program. So, the Promotores de Salud are community health workers. It's that kind of model. They are people from the community who go into different community settings to reach those who are vulnerable, right? So our community health workers, our promotores de salud, are exposed and observing and hearing from devastating cases, very tragic, as people come into cities like sanctuary cities like New York City, for example. We have heard of sexual assault cases, murder, people just coming seeking basic needs like shelter, food, work, and healthcare. So um, that's where our team has been trying to contribute to by partnering with other organizations as well to be at the in the trenches, trying to see where the needs are and how we can how we can help. Um, so that's sort of where we are, and obviously this the important piece here is that our team is also connecting community members and the new migrants, asylum seekers, refugees to our health centers to get them the sexual and reproductive health care that they desperately need.
I think that sometimes, when we talk about sexual reproductive health, migrants, asylum seekers, they're not at the forefront of the list. And I know that's the great job that you guys do in terms of making people aware of what's going on and what some of those specific needs are. When you get those persons who come across your door, how hard is it, if you will, to get them? Because we talk a lot on our show about access to resources, right? And how many times people are really plagued by access to resources. But not only do you provide access to resources, you also help bridge that gap.
Yes, so on our end, we are tackling this issue from different perspectives and different approaches, right? So we are providing the clinical services. At Planned Parenthood, we do not um, turn anyone away just because of the lack of ability to pay or lack of health insurance. We are trying to accommodate our schedules. Our clinical team is ready to serve these communities as well. And our community-facing teams, like the promotores, like our RAIS program. RAIS is our part of our organizing team. They're trying to advocate for these communities as well to receive the services they need. And our our team also advocates for the passing of federal bills like coverage for all, for example. Well, that's the New York State bill, and it would expand the essential health plan to include people that do not have access to healthcare because of their immigration status. But also at the federal level, we need to be able to facilitate the new migrants to obtain their working permits, for example, that would enable them to make an income and living. That means that they will be able to receive transportation and pay for healthcare services, even if they're, low cost health services as well. So that's why it's all tied together. That's why all of that is important. So we approach it from the clinical standpoint, from the community engagement standpoint, and also advocating for policies that can improve the lives of all the new immigrants as well as the old-time immigrants as well,
Yeah.
and all other marginalized populations.
When we talk about marginalized populations, sexual health is a big issue, and I want to talk about sexual health because it's viewed as a social issue, a racial justice issue, an immigrant issue. How do you make the correlation between sexual health, immigrant, and racial?
They are all tied together, even if it may not seem evident on the surface. Racial justice is sexual and reproductive health justice, right? Reproductive justice is racial justice as well, for various reasons. Because when we are talking about reproductive justice, for example, we talk about having bodily autonomy. And what does that mean? It means that every human being has the right to make decisions about their own bodies and about whether to bring children or not, how to raise their children, under what circumstances. And we all deserve to raise our children in a safe, sustainable environment. So when we see the intersection of race, for example, in our communities of color that are, and the bodily autonomy and that right is taken away, which has been done, particularly in recent months or the recent couple of years. All results in our communities of color becoming even more marginalized and not having that ability to choose, right?
Right.
So that is part of the issue. Also, the other way in which it intersects, for example, and specifically to the immigrant community, is that a lot of our immigrants in Latinx communities, for instance, live in the states that have implemented severe bans on abortion, for example. So when people seek a healthcare service such as abortion and they don't have the access to it, their lives are also altered. They are faced with very difficult decisions, and they might end up, it affects not only themselves, but their whole family, their financial stability, their whole family unit also gets affected by these policies and these barriers that we're facing. So it's all interconnected.
Yeah. And when we talk about being interconnected, obviously, there's a lot of common threads that weave all of this together. We talk about, sexual health. We talk about reproductive health. We talk about access to affordable health care. All of those things are common threads that we always talk about here on the show, and we see prevalent in our own communities. But when we talk about stigmas, I want to have an opportunity to share a little bit about that because there are some stigmas that sometimes do create these barriers, right? And I want to give an opportunity for you to address some of those stigmas and let's clear it up because I think that would be better in terms of landing safely because when you have stigmas out there, it's sometimes it becomes a hard sell for people.
Absolutely, and that's a great point. Stigmas and the reality of systemic racism plays a role in sexual and reproductive health as well. In fact, throughout history. So, what it translates to in terms of their daily lives for an immigrant, for example, is that they're facing language barrier. They're also stigmatized by the healthcare system, and there are we know that the quality of care and the way these communities might be treated are different from what other people with more access can get access to, right?
Right.
So for example, the language, immigration status, for instance. We have heard of cases where in some healthcare institutions or in some healthcare system or settings, people who don't have English proficiency, their symptoms might be dismissed, or they are not necessarily explained what their diagnosis might be. So they get a lot of misinformation. They are not able to advocate for themselves. There's a lot of insurance claims that might get denied, and you know, again, that creates this whole other set of issues stemming up from that. So, so the sexual and reproductive care, it is crucial. These communities need access to it. It's life-saving. So having access to cancer screenings, for example, which affects the Latinx community increasingly, for example, cervical cancer or STI testing and treatment, HIV, for instance, that also affects especially Latinx women and trans women. So all of those are conditions and needs that are affected by the stigmatization and almost dehumanization of immigrants and members of the Latinx community as well.
Yeah, and I know that everybody's been dealing with the after effects of COVID, but what has COVID done for the organization in terms of the work that you're doing, increased caseloads? Talk to me about how you guys are navigating in this. I can't say it's a post-COVID environment, but you get the drift of where we are today.
It was definitely challenging, as it was for many institutions, especially nonprofit organizations that already operate under capacity and with limited resources, right? But I think our response as an organization was incredible. And on the clinical side, there was a transition. And we never stopped offering our services. There was commitment from our clinical staff, everyone to continue providing the services and keep our doors open to those who need it. There was also an expansion into telehealth, for example, and a lot of our services are still to this day able to be provided via telehealth, which it has been a positive outcome of that whole transition into more of the virtual world that we all now live in. And in terms of our community engagement team and also our education team, for example, we also transitioned into providing education and outreach programs virtually. So now we do a mix of both. Our work is hybrid in terms of community, forming relationships with community and collaborations and partnerships, which is very crucial to our work. So we're able to even reach more communities and across the city and also the state, because we have that that approach that was initiated through the COVID crisis. So we continue to provide that work as well. So it was one of the again, the benefits and positive outcomes, so that we can carry that into the work. And it has facilitated a lot of collaborations that we never imagined.
Yeah, yeah. Well, Angelica, I want you to take a few moments for those of us who may not be so familiar. People may know Planned Parenthood only in one dimension only, but share with us a little bit about the work that Planned Parenthood does throughout the course of the year.
So we are a big organization. We provide a lot of different services. As you mentioned in the introduction, we have 23 health centers across the New York State region, providing those clinical services, which range from cancer screenings like cervical cancer, breast cancer screenings, for example. We also provide STI testing and treatment, pregnancy tests, options counseling, abortion services, the whole gamut of sexual and reproductive care. We don't stop with the clinical services, so we complement that with helping our communities and hearing our communities about their needs, and how and forming those meaningful partnerships with community agencies and other stakeholders, so that we can tackle some of the other issues and all the other intersections, such as racial justice and economic justice. So because it's all connected, right? So in terms of other teams at Planned Parenthood, there is education. For example, we have a big team that goes into schools to provide comprehensive sex education, which is incredibly important, so that people can make informed decisions about their own bodies and their own healthcare. Our team, which is community engagement, we reach adults. So we have teams for youth, we have teams for adults, and also our advocacy arm, which does great work at the legislative level as well. So we expand the whole gamut of services in the fight for sexual and reproductive rights and equity for all.
Yeah, a lot of work goes on, and we want to thank you, Angelica, for being with us. Angelica Medina, who is also the Director of Community Engagement for Planned Parenthood of Greater New York. We thank you for taking the time to share with us a lot of stuff to pay attention to, and of course, we'll keep our viewers up to speed. So thank you for taking the time for being with us.
Thank you so much for having me. It's a pleasure.
All righty. Well, we're taking a quick break, and guess what? We'll be back with more right after this.